want to introduce a special guest to give us a few remarks here. Heidi Jannenga. She is not only the co-founder and chief clinical officer at WebPT, but the co-chair of GPEC's Healthcare Innovation Council, a group that meets to advance the region's leadership in the healthcare industry. Heidi brings with her more than 15 years of experience as a physical therapist and multi-clinic site director, as well as passion for healthcare innovation, entrepreneurship, and leadership. Heidi, thank you so much for kicking us off today. I'll give the floor to you.
Thank you, Eric. Good morning and welcome, everyone. Thank you so much for joining us today. As Eric mentioned, I co-chair the Health Innovation Council at GPEC alongside of Allison O'Toole, who's the Executive Director, Corporate and Community Relations at the University of Arizona Health Sciences. Now with the HIC, our goal is to enhance the healthcare innovation ecosystem by sharing best practices, highlighting innovative startups and scale-ups, as well as supporting work that enhances our ecosystem assets and resources. I'm sure, just like you, that we're all looking forward to hearing Dr. Chris and Linda Hunt, who actually was my previous HIC co-chair, on the status of the vaccine distribution in Arizona and how we can help. I'm also very eager to hear Mark's remarks about the economy and what we can expect in 2021. But before I turn it back to Eric, I think I can speak for all of us in the GPEC audience here today that we would very much like to extend our deepest gratitude to all of the healthcare providers and frontline workers for their long, exhausting hours dedicated to keeping us safe and healthy. With that, back to you, Eric.
Absolutely. Well said, Heidi. Thank you so much. Okay, if you saw the RSVP go out, I want to introduce our phenomenal panelists we have today. Chris Camacho, President and CEO of GPEC, is joining us. Dr. Cara, Director, Arizona Department of Health Services. Linda Hunt, the CEO of Arizona Hospitals at Dignity Health. And Mark Vitner, Senior Economist at Wells Fargo. Okay, let's start with you, Chris, for an update on our economy. We'll send it over to you, sir.
Great. Thank you, Eric. And just to echo Heidi's comments, thanks to the healthcare leadership and healthcare frontline workers for all the work, the long hours. I can tell you firsthand in talking with Dr. Christ and certainly with Linda over the past few weeks, it seems like every time I'm on video calls with each of them, they're on the front lines, working on behalf of all Arizonans and just this kind of neighborhood spirit of neighbor helping neighbor and getting us back to a place where we all feel comfortable and hopefully safe. As we enter the 21 season, there's an inextricable link between consumers feeling confident and getting past this challenging pandemic, coupled with our ability to see the economy recover. So hats off to each of you that are out on the front lines working tirelessly. It doesn't go unnoticed, so thank you very much for that. What I wanted to shift to just briefly, and I'm eager to hear too from Mark on the national economic landscape and snapshot. Because this is a very interesting time. As we sat here, I think this might be, or maybe yesterday was the anniversary of kind of the first notification of COVID. And I think many of us, me included, thought we would be well past this by this point. But certainly the economy has had its challenges in 2020. So as we sit here in the January time period here, I am optimistic about the go forward within our state and in our region. And there's so much happening around the world, and I wish I had more time to talk about what I believe is this great American reset that's occurring, which I do believe will not only play to the Southwest and the Sun Belt advantage, but certainly Greater Phoenix as a region is going to be, I think, placed within one of these top job growth and recovery communities of anywhere in the country. And there's so many reasons why I believe that. But before we be too optimistic about what we expect in 2020 or 2021, excuse me, I want to make sure we draw attention to the fact that we had a run up post the past, the last great recession back in 2008 to that recovery period in 2012. It was 17-quarter recovery. For those of you that were here, remember that, how hard it was. We had steady growth really for the past 8 years. It led the national scene in terms of job growth, GDP growth, and net relocation and migration activity. But I certainly applaud Governor Ducey and the legislature for a lot of the pro-business policies that put us in this curve where you can see really 2012 to 2020. And certainly the spike that we saw leading up through December of 2019, and then the horrific kind of national picture in Q2 for all of us. We saw GDP contract, unlike we've ever seen it contract, certainly in our lifetime. But again, as you fast forward here, you're going to see a theme that Arizona and certainly Greater Phoenix as a market is very resilient. And we will see an unevenness, unfortunately, of some of these lagging sectors. And so go to the next slide and I'll cover a little bit more as to what we're seeing on the front line. So as you can see, that second quarter, we lost roughly 215,000 jobs. 80% of those roughly were concentrated in leisure, hospitality. As you can see, professional business services, healthcare, and social assistance. Retail got massively impacted, as did leisure and hospitality. What's unique, however, about this particular pandemic-induced downturn is the massive unevenness. So certainly you're going to see retail come back as we see more consumer confidence. You're going to see leisure, hospitality, and travel come back as we're able to travel. And obviously the industry is impacted by lack of tourism, a pretty significantly felt impact. I was on a call with the city of Scottsdale today. They've seen a 30% reduction in what they call the head and bed tax. So our cities are feeling that aspect of it, but writ large, because of the decision a couple years ago in the Wayfair case, which allowed cities to collect online sales tax, our cities are actually doing very, very well, different than expected. So again, you're going to have a very uneven recovery. Corporate activity looks very strong. Consolidation activity across the country because of liquidity and I believe our labor concentration along with livability attributes. Greater Phoenix, like Dallas, like Austin, like some of these markets are going to do very well in 2021 into 22. So go to the next slide here. When we talk about the recovery, you'll see that, again, I just want to draw your attention to the center bar here, which looks at sector gains since really the trough. So when we hit that skid in the second quarter of this year versus where we see that recovery, while we have posted some significant job gains and recovery, we still have a long runway to go in retail and leisure, hospitality, and some of the healthcare jobs. Whereas financial services has already recovered and has actually added jobs, technology's added jobs, e-commerce has added jobs, transportation has added jobs. So again, that's what's rounded out our overarching position for the current economic climate here. Go ahead. I think I have one or two more slides just to share with you. Unemployment claims, as you can also see, peaked in the latter part of the second quarter, had a little bit of lag on that, but you've seen the 52-week change pretty significant, and we're hoping that this curbing of what you're seeing with continued claims will continue to flatten out over time as we get every Arizonan back to work. One of the things we are working on is a pretty massive reskilling effort around a couple different industries where jobs are going to be as we transition from a post-COVID world into this new economy, which is going to be centered on digital technology and certainly, areas in which jobs are in demand. You are going to see a bit of a supply-demand challenge, not only here, but nationally. So there's going to be a need for a massive national reskilling effort around in-demand jobs. Yeah, go ahead. And so let's look at the forecast. So a lot of economists, again, are looking at a 21 recovery for the most of the national condition. What we're saying is in Arizona, we do expect full jobs recovery. Could be as soon as third quarter, most likely fourth quarter this year. But again, what I'm watching is if you look at the disparity of those with a high school degree or below, we're still running very high in the teens unemployment rates, whereas those with baccalaureate degrees are a much lower unemployment rate. We're seeing near 7% unemployment for those individuals. And so again, the unevenness is going to cause, I think, a challenge from a sustainable economic position, from an equity approach, and ensuring that we are focused on socioeconomic class equity is going to be very important for all of us. So with that, that's kind of the current update. You've probably read a little bit of the headlines you might have seen in the Wall Street Journal. I can't comment on any of these active projects, but a lot of speculation around some mega deals that are circling our waters. And, maybe we're even though we're in the midst of this really challenging time, we are in 2021 and we're seeing snow in Phoenix, or at least hail in Phoenix, which we're not used to. But I do look outside today and I'm finally seeing the sun after 2 days. So who knows, all bets are off for 2021, the fact that we hadn't seen the sun for a day and a half. But I am eager to hear from my colleagues, and I want to kick it back to Eric, and I'll stick around for any other questions we'll have towards the end of the program. Thank you very much.
Thank you, Chris. Great information as always. And yes, we will check back in with you a little bit later for some moderated questions and some questions from the audience. Okay, let's bring in Dr. Cara now. Dr. Chris has been with the Arizona Department of Health Services for over 9 years in multiple positions. Dr. Chris has a strong commitment to the health of the people of Arizona. Among her many accomplishments at ADHS, she collaborated with health partners and stakeholders to develop strategic plans for infectious disease prevention and control, including the Governor's Council on Infectious Disease Preparedness and Response. She was involved in leading statewide efforts during the 2009 H1N1 pandemic and worked with partners to find solutions to improve childhood vaccination programs. Dr. Chris, thank you so much for joining us today. I know you have to run at 11:45 duty calls, but we do have some time in the meantime to go over some information as we talk about the vaccination rollout and other efforts going on in our community right now. So I'll turn the floor over to you.
Thank you very much for having me today. So today is when we mark our year anniversary that COVID came to Arizona. And so it has been a very interesting year where we have learned a lot. As of today, we're over 730,000 cases of COVID-19 and have sadly lost over 12,000 Arizonans to this pandemic. I think the bright light at the end of this tunnel has been the development and release of vaccine. I think that this would be a very challenging time right now if we didn't have that glimmer of light at the end of the tunnel. And our partners have been doing a great job. In total, 486,338 vaccines have been administered statewide, and that continues to increase every day. The major limitation in Arizona has been the amount of vaccine that we're receiving from our federal partners. And so just like all of our other counterparts in states, we are continuing to ask for additional resources to get as many Arizonans vaccinated as quickly as possible. Some of the things, as we've been planning over many, many years for potential pandemic response, these vaccines do have additional logistic challenges. So just in getting everybody to a site or to a vaccine once, you're not fully protected until you get that second dose, at least with the two current vaccines that we're looking at. There are two types of vaccines we currently have, Pfizer and Moderna. The Pfizer, you can get your second dose 21 days afterwards, and the Moderna, it's 28 days later. There are reporting requirements that we have to provide to CDC, which they are using to determine Arizona's allocation, and all of those provide logistical challenges as we continue to try to get the doses into more arms in Arizona. In Arizona, we are a home rule state. So our counties are the boots on the ground experts for their communities, and they have the jurisdiction determine the distribution and the allocation within their communities. ADHS provides technical assistance and support from the state level, but they're responsible for providing direct service to their communities. During this pandemic, there have been several times where we have stepped in to provide technical assistance and with implementing consistent plans at the local level when needed. And some of those examples include testing, PPE support, enforcement of mitigation measures, hospital capacity and staffing resources, as well as now helping out with vaccine distribution. So we are currently in what Arizona considers to be our prioritized phase 1B. So Arizona has a vaccine and antiviral prioritization advisory committee, we call it VPAC, and they determine when we have resources that are significantly limited and have to be allocated out, they will determine the prioritization of that. Currently, our phase 1A was things that people are already aware of. So our healthcare workers, those providing frontline care, those supporting our hospitals and healthcare institutions, as well as our long-term care residents and staff. We know that those populations have been adversely impacted by COVID-19, and they were a priority. As we move into prioritized phase 1B, that is our protective services occupations. So our law enforcement, correctional officers, child safety officers, as well as those providing protective services in the community. Also included is our educational and childcare providers statewide, and then adults over the age of 65. And so those are in our prioritized 1B. Many based on their current distribution of vaccine are holding at the 75 and above age category in 1B, and we will continue to expand. Our 1B category also contains, as we move farther into it, are essential workers that need to be vaccinated. So that's going to be workers that support our transportation industry, the food chain, critical infrastructure that is required to keep our communities going. And then also it will eventually include any adults of any age that have an underlying medical condition that put them at more risk. Based on the current vaccine allocation, we anticipate from a statewide perspective being at full phase 1B probably by mid to end of February. So we are currently working with our county health departments who have the ability to sub-prioritize some of those essential workers to get them vaccinated as well. In Arizona, one of the things that we have taken a go at from the state perspective is we implemented on January 11th a state-run 24/7 vaccination site at State Farm Stadium. In addition to the sites that we're activating in both Maricopa and Pima County. This was directed at the request of Governor Ducey for us to launch this. And I will say that the partnership of the community coming together to help us launch at State Farm was incredible. We are currently partnering at that site with the Arizona Cardinals, Blue Cross Blue Shield of Arizona, Walgreens, Arizona State University, as well as American Medical Response. And we were given funding by the Ben and Catherine Ivy Foundation to help us support this site moving forward. As of January 26th, we have administered almost 80,000 vaccines just at that site. We're administering about between 200 and 300 vaccines per hour. That's 24 hours a day, and we're getting between 5,000 and 6,000 doses each day. We did have to pause operations a little bit yesterday with the severe weather that came in, but rest assured, if you had an appointment at that time, we will honor it throughout the rest of this week to get people for their vaccine. We're making lots of improvements to that site and are using that as our model for expanding to additional sites. So right now we are scheduling second dose appointments while you're waiting in our wellness lot so that you leave with your second dose appointment. And we've gotten a lot of customer feedback on our web registration portal that should go live coming up here on February 1st. On February 1st, we'll be partnering with Arizona State University and several other partners to launch our second site at the Phoenix Municipal Stadium. That will have the same capacity as State Farm. However, it is going to open up with very limited doses given our limited resources. So our next steps really going to be scaling up to add capacity around the state, looking at developing state-run regional sites, and getting more doses into the arms of Arizonans. We're also going to be looking at where that vaccine is currently. We've got a lot of doses in the state that aren't being reported as being used. So we are going to be working with providers that may have doses to see how we can get them to higher impact sites and get them into the arms of Arizonans. And then also looking at some of those really hard to reach communities, such as our senior communities, areas that may have individuals that are at higher risk due to demographics or to high risk comorbidities, and really taking the vaccination to them as we continue to expand. And so with that, I will turn it over to our next speaker.
Dr. Chris, thank you so much. And again, I'm sure, speaking for all of us, thank you for everything you guys are doing right now. And I do want to remind the audience viewing, we have a really large crowd, that Dr. Chris does have to take off about 12:45. So if you have any questions, try to please submit those in the Q&A feature at the bottom of your screen, and then hopefully we can get to those. We'll prioritize them. Okay, let's shift back to the economy before we go back into healthcare. Mark Vitner, let's bring Mark into the conversation. Mark is the Managing Director and Senior Economist at Wells Fargo, where he is responsible for tracking U.S. and regional economic trends. Based in Charlotte, North Carolina, he also writes for the company's monthly economic outlook report and the weekly economic and financial commentary. He provides regular updates on the housing markets, commercial real estate, regional economies, consumer spending, and issues impacting small business. Mark's commentary has been featured in the New York Times, Wall Street Journal, Bloomberg, and many other publications. So Mark, thank you for joining us, and let's shift the focus back to the economy now for some information. I believe you have some slides to share with us as well.
Yes, and if you go ahead and flip to the first slide, in terms of where we are right now in the U.S. economy, we had the lockdown in March and April. We bounced back from that very quickly. The economy, when you look at the high frequency data, which is something that's really it's kind of an innovation that came with the COVID environment, where we started looking at things like online dinner reservations and the number of people who went through TSA checkpoints and all of the data that you can get from smartphones. All of that data shows that the economy actually bottomed out on April 15th. So we had the shortest contraction in U.S. history. It produced a 30% drop in GDP in the second quarter, a 33% rebound in the third quarter. We won't actually recover all of the losses in GDP probably until the first quarter of 2022, even those percentage gains would indicate that we're doing better than we are. There's some arithmetic that goes with that. We're going to get fourth quarter GDP on Thursday, and the economic activity pulled back in the fourth quarter as COVID cases reaccelerated. And that reacceleration in COVID cases also helped bring the two parties together to pass another relief package. And that stimulus package is not going to be the difference between recession or growth. I don't think that was ever a threat for the economy. Growth is certainly going to slow in the first quarter, but we're looking for 4% GDP in the fourth quarter. We did have some negative numbers right there at the end of the quarter. Non-farm employment declined by 140,000 in the month of December nationwide. And we also saw that retail sales declined in December. Both of those drops were largely due to declines in activity in high contact areas of the economy, mainly restaurants, bars, entertainment venues, and to some extent, retail stores. And it looks to me like most of that decline was in California and New York, which instituted fairly broad lockdowns of those types of activities as COVID cases picked up. When you go beyond that and you go to warmer climates, you see that we're able to have outdoor dining. You see that employment actually picked up, and it's most prominent in the South. The biggest job gains were in Texas, Georgia, and North Carolina. In terms of how we see COVID playing out, the pace of vaccinations has picked up. In the latest week that we have data for, we were average 1.25 million and a quarter vaccinations a day during the week ending January 24th. Hopefully we can keep up that pace or maybe get it up a little bit higher. It's not 1.25 billion people that are completing the course because of course you need two shots. But I think that we could reach a threshold in early to mid-summer where people would once again re-engage in economic activity, go out and about and visit restaurants, travel, and go back to work in offices gradually over the summer. If that were to come to pass, we would have much stronger growth in the second half of the year. And that's what we're looking for. After a slow start to this year, 1.5% growth in the first quarter, we think the spring will be a little bit better with 3.5 to 4% growth. And in the third and fourth quarters, we're probably going to average about 8% growth. Now, I only have a few minutes and we'll be able to hopefully address some things and questions. But the third point that I have on here is that the geography of growth has changed in a big way. And what we are seeing is that even before COVID, there was a movement away from large, globally connected, densely populated cities like New York and Boston on the East Coast, and San Francisco, Los Angeles, and to a certain degree, Seattle on the West Coast. And folks were either moving to the outer suburbs around those large cities, or they were moving to alternative cities that tended to be smaller, less congested, including Phoenix, Las Vegas, smaller cities like Boise and Reno, and then of course, Texas, Dallas, and Austin. We think that that trend is going to continue when we move past COVID. We're going to see a continued out-migration. It is the revolution that we've seen in the ability to work remotely. It has made it much easier for folks to access the ecosystem that existed in New York or San Francisco or LA without having to be there. And so that's making it much easier for companies and workers to move to other states. So we think that that's going to continue in a big way. The move to the suburbs is also going to be driven by the aging of millennials. Every year of this decade, more millennials will reach the age of 40, and each successive year going all the way to 2029. And that aging of the millennials means that more of them are reaching a point in their life that they're getting married, having children, and looking to buy a single family home as opposed to living in an urban environment. And that will also help further this move away from those expensive, densely populated cities and favoring places like Phoenix. So there are a lot of trends that I see going forward that are going to be big drivers for growth. Tech, aerospace, defense, all have a long runway ahead of them. So I'm going to stop there. I give you the overall numbers. We are looking for job growth to recover along the lines that you saw earlier in the on the national chart in the local presentation. I don't know if we'll get to where we were prior to the pandemic by the end of the year. The real key is 60% of all the jobs that we have not recovered are in these high contact areas. Most of them are at restaurants. Restaurants lost 1/2 of the jobs that existed prior to the pandemic, and they recovered about half of their job losses. But hair salons, fitness centers, repair shops, all bars, entertainment venues, they're not going to see a recovery until people feel it's safe to move about and to re-engage in the economy. I don't know exactly what threshold we're going to have to hit in terms of vaccinations, but I feel pretty confident that we're not going to get there until early to midsummer.
All right, Mark, thank you so much for that information, and stick around. We have some Q&A coming up in just a few moments. Let's go back to healthcare now and bring Linda Hunton. Linda oversees Dignity Health's Arizona service area, which is anchored by 5 outstanding hospitals. Under Linda's leadership, Dignity Health in Arizona has grown into a respected and comprehensive healthcare system, which also includes imaging centers, specialty hospitals, physician groups, clinics, freestanding emergency rooms, urgent cares, insurance providers, an accountable care organization, a medical school campus, and other clinical partnerships. During her previous role as president and CEO of St. Joseph's Hospital, the 593-bed facility became the busiest hospital in Arizona and attracted patients from all over the world to its Barrow Neurological Institute and the Muhammad Ali Parkinson Center. Linda, thank you so much for joining us this afternoon. I believe you have some slides to share as well with us, so I'll turn the floor over to you.
Right. Good afternoon, everybody. Well, when I think about what this year has been, I have to tell you, I have been in healthcare for 50 years, and I would have to say through tornadoes, hurricanes, floods, everything you can think of, this has had to have been the most challenging year. The good news is that we have hope on the horizon, and really my slides are really to share with you pictures of our staff who are 12 hours a day standing out giving vaccinations. We're responsible for the Southeast Pod. Thanks to the county and to the state working with us, we have given over 72,000 vaccines as of last night. Just like everybody else, we had to shut down early because of the weather. The really worrisome thing that I have to tell you is that I think everybody's tired of this pandemic. Healthcare workers are tired of it. People, the general public are tired of it. And I wish I could say it's over, but it's not. So what do we need to do? We need to continue to do the things that we know have worked. And that is masking up, social distancing, keeping your circle small, washing your hands probably more than you've ever washed them before. And if you're sick, stay at home. Please don't go out grocery shopping or go into work. Why am I concerned about that? Is because we are continuing to see the spread of COVID. Yes, it slowed down. About 2 weeks ago, the hospitals were at over 150% capacity throughout this community and most of the state. Why were we at 150%? If you remember, that's what the governor asked us to get to. And I can tell you, we had patients in cafeterias and any place that we could put a bed, we put a bed. We have seen a decline over the past 2 weeks, so that's great news. And with the vaccine, we're hoping to see that continue. We've had great partnerships, as I said, with the city, the state, the county, but also with businesses helping us. And we're out in the Southeast Pod, so Chandler and Gilbert have been great partners, and the police department and the fire department helping us successfully navigate all these people that need the vaccine. So what are we planning to do now? Well, the one thing we have seen is chronically, we are understaffed for nurses and for physicians and respiratory therapists. So we have got to continue to educate physicians, nurses, and other healthcare workers. The other thing we have to do is we have enough beds. We just don't need a pandemic anymore. So we have to do everything in our power to get that curtailed. Some other exciting things that are going on is innovation. Many of the technological advances we have made have been very helpful. Think about a year ago, would you have thought about a virtual visit? But that has been a godsend for especially people with chronic disease. They have continued to get care. People who want to have diagnosis but don't want to go into an emergency room, virtual visits have been an amazing advantage for many of our practitioners as well as our patients. But there are other technologies. We have technology such, if you're diagnosed with COVID, you can stay home and we can monitor your oxygen saturation so you don't have to be hospitalized. At one point, we had close to 500 people being monitored at home for oxygen saturation, and only a few of those had to come into the hospital. So again, I'm excited about the vaccine. You know, our staff are continuing to screen people to give vaccinations. If you have vaccine available, take it. I know there's a lot of myths, and we'll probably, unfortunately, Dr. Chris probably has had to get off, but we're going to produce some videos and information about vaccine myths because people are getting misinformation about this vaccine. I personally have had it. I have had no issues. I had a sore arm, and that was about the most that I had. And I had the Pfizer, but other people have had the Moderna and had a similar type of reaction. So as I said, what can you do to help us? You can continue to do social distancing, masking up, washing hands, and stay home if you're sick. Thank you so much.
Thank you, Linda. And I think we still have Dr. Chris with us for 10 more minutes or so. Is she still on the line? There she is. Okay, we'll move on to Q&A for a moment, and I'll try to prioritize these and fire a couple of questions off for you, Dr. Chris. One of the first ones is in regards to, and you touched on this briefly, is the phased vaccine rollout working as intended? And then sort of to what Mark's point was, are you comfortable with the pace right now as you look at the economy side of things, and we're all trying to balance this pace and getting people out to return to restaurants, return to movies? Where do you feel the pace of the vaccine rollout is right now?
Well, we would always like to see more vaccines in the arms of Arizonans. So we would like to continue to accelerate the pace. I think that the phased prioritization has worked. You know, we really needed to focus on our healthcare workers. They are critical to this pandemic, and also those very vulnerable individuals in congregate settings and skilled nursing facilities. But, you know, as we look at what we've got, Arizona, as of this week, will have received over 1 million doses of vaccine, and we've administered about 500,000 of them. So we want to continue to increase and accelerate that rate so that we can get closer to, being where we're getting it in the state and it's being administered right away.
Right. Okay. Another question coming in, and I'm reading these from audience submissions. How is the state working to ensure low-income communities and communities of color receive the vaccine, especially those communities who don't have internet access or are non-English speakers? Is there targeted outreach?
So we are working with some partners to do some targeted outreach to zip codes in areas that we know have been significantly impacted, as well as working with school districts and the county health departments to provide that targeted outreach as well, because we understand there's technological issues. There, just like Linda said, there is misinformation out there about the vaccine, and we want to make sure that these communities get the vaccine that they need to stay protected.
Got it. Thank you. And one more question coming in. When do you see the third vaccine coming to Arizona?
So what we've heard is that on the horizon, Johnson & Johnson will be submitting the data and the information for their emergency use authorization to the FDA. We anticipate that potentially coming online at the end of February. And the nice thing about that vaccine, what we're hearing is it's a 1-dose series.
Got it. And then, sorry, one more that just came in. And we do have about 260 community leaders on this call, so this can help to extend to other circles. Are there any opportunities that still exist to volunteer at State Farm Stadium at the vaccination center?
Yes, there are. And so we collect, if you go to azhealth.gov, we have a volunteer portal that we can use. Our partner for volunteers at that site really is Blue Cross Blue Shield of Arizona, as well as ASU. But as we continue to expand additional sites, we are always going to be looking for volunteers. So if there's an organization that wants to volunteer, they can reach out to me or to the department, and we'll see how we can incorporate them into future plans.
Dr. Chris, thank you so much. I appreciate it. I know if you have to hop off, feel free. I do have a question for Mark and Linda, actually. This kind of ties into both. And Mark, we'll start with you. Are there any preliminary calculations about the financial impact of the pandemic specific to healthcare organizations? As I said, you'll be great, and then we'll have Linda follow up to that answer.
That's a little too micro for me in looking at the actual organizations. And if I was to cite one, that would probably violate some confidentiality. Certainly, one of the things that we've seen is that discretionary healthcare services, you've had a huge drop in purchases of elective surgeries and elective procedures and even doctor's visits. We know that from looking at the consumer spending data. You can see how much consumers are spending out of pocket on healthcare, and it plummeted. And so, that certainly has had an impact. I think that the industry is also going to have to invest for telemedicine, which I think that genie's out of the bottle, and is going to see tremendous growth over the next decade.
Yeah, thanks, Mark. And Linda, I'll let you follow up. And you mentioned telemedicine, but just the financial implications from the pandemic and where you see things moving forward.
Right. We have seen a tremendous drop in elective surgeries, as well as any type of elective types of procedures. The first surge, people just stayed away from the hospital, which was very frightening, because people who should have been getting care for heart conditions or other type of conditions weren't. And so then when they did come to the hospital, they were very sick. So thank God for CARES Act. Thank God for Governor Ducey and Dr. Chris. They have helped us with, for example, St. Joe's would have lost about $126 million at the first surge. But thanks to the CARES Act and some other things that we were able to do, we were able to offset almost all of those losses. The most recent surge, we have been very full. But our biggest challenge is the cost of labor. With the shortage of nurses, the shortage of around the country nurses who travel. These are people we usually bring in the winter here when we see a number of winter visitors come in. The traveling nurses' salaries tripled in what we normally were paying. So in fact, I'm a nurse by background. I kept threatening my boss. I was going to get my license activated again and go travel, because in a 2-week period, most of the nurses were making over $12,000 in a 2-week period of just their salary. So you can imagine the impact of an organization having to pay that money. So it's been a tale of two edges, the edge of the elective cases, and then not as many people coming to the emergency room, but the ones who come to the emergency room, most of the time, 23 to 40% of those people are having to be admitted because they're that sick. And then, our hospitals being at the brim of capacity all out throughout this entire community and through the state.
So Linda, I think it's worth zeroing in there. You just mentioned it. It's been a common theme this year of patients putting off healthcare. Do you see that trend improving right now, or are we still struggling? As you said, you don't want somebody putting off care and then showing up in the emergency room really, really sick. So is that trend improving, or is that message still need to get out there that it's okay to go see a doctor right now?
I think it's still out there. I think people are afraid to come to a hospital because they know we have a lot of COVID patients in our facilities. So if you can put off, many people are putting off care, which is not a good idea. Now with telemedicine and different ways of receiving care, we're trying to encourage, and we continue to get out the message. Our facilities are, clean where the general public comes in. We require obviously masking and certain procedures that have to occur, but it is safe to come to your doctor's office. It is safe to come to the hospital. It's just you're going to be required to do some things like not have visitors with you, which is really tough if you're coming to the hospital.
All right, thanks, Linda. Dr. Chris, I see you're still there, so I'm going to hit you up with one more question. Does it look like a different vaccine will be needed for the newest strains of COVID, or will the current vaccine most likely cover them?
So it looks like the Pfizer vaccine currently covers the strains that we are seeing emerge from like the UK and South Africa. I know Moderna is working on potentially another vaccine that will better address some of those variants. I think that is, that's going to be a challenge moving forward because viruses mutate. They are always trying to make sure that they can continue to exist and proliferate just like everyone else. So that's something that we're always going to have to be monitoring with COVID-19.
Dr. And this is just, you mentioned myths before, Linda mentioned myths. What are some of the myths surrounding, because there's so many cases in our state that if you've had COVID, you don't necessarily need a vaccine?
So that is one of the myths that we've heard, that if you've had COVID, you don't need a vaccine. And that is not what we are seeing with this current virus or disease. What we do know is that people can be reinfected with COVID-19. It's usually about 90 days or longer after their initial bout. Their second bout can be worse than their first bout. And we don't believe that you have long-lasting immunity after an infection. So we are encouraging everybody to make sure that they get that vaccine in order to stay fully protected.
Quick question about masking. Do you anticipate there will be any state mandates around mask wearing?
That we have statewide mask mandates in the establishments that ADHS currently, it's not necessarily a real regulation, but for those businesses that had to be paused and reopened, so restaurants, nightclubs, bars, gyms, movie theaters, 100% of those are required to have both staff and guests throughout the state wearing masks. What we really need help with is from our local jurisdictions to help enforce those mandates. There's a lot of different requirements that all of those businesses have to comply with, and having more eyes and more hands would be a great benefit.
Great. And one other myth, right, around masks and vaccinations. So if you get a vaccination, you should still wear a mask, correct?
Correct. So, we are in the beginning stages of vaccinating Arizonans against COVID. So the best form of protection right now we have is the vaccine, but also masks. And so we don't know necessarily if you could still get it and be asymptomatic even after the vaccine, but transmit it to others. And until we get achieve herd immunity, we will need to continue to wear masks.
Right. And Chris, I saw you hop on. I see you're there. Speaking of the rise in cases that we just saw, Arizona has been in the national media for some of the previous weeks. Given the case numbers, how has this impacted deal flow and prospects evaluating our region?
Well, I would say certainly there's been delay in travel to the market, which is an important step in our recruitment process. So as you can imagine, companies are performing much more data due diligence virtually and digitally. And so you imagine us trying to pitch new companies over Zoom, which is not as easy as building a relationship, in person. But we're still seeing activity continue. But again, I think you couple COVID and our surge that we had over the last quarter with the election, which obviously created also some notoriety for our state. I think on the COVID side, as both Linda and Dr. Christ and others have referenced, that there's an absolute response that we've come together as a community to work on this issue and establish additional sites beyond State Farm and now Phoenix Muni and others. Our community's leaned into this response. I think what we need to continue to do is, as we compete with other places, so Texas and Utah and these other markets, and companies pay attention to a market's brand and how they respond to crisis. And I'd argue that's what we're doing. And so what I've advocated for to our legislative body, as well as our congressional delegation, is let's be positive about being in Arizona. Let's be positive about our brand. Let's not put ourselves in unnecessary positions to be in the national spotlight. And unfortunately, we've done some of that. Some of our congressional delegation members have put us in that position. And so, I'd obviously prefer us to be more known for an innovation-centered economy and a resilient focus as to how we're dealing with COVID. So we'll continue down that path.
Thanks, Chris. Linda, I have a question coming in for you. I continue to hear some people question really how much different COVID is from a really bad flu season. Can you comment on how different hospital capacity is in Arizona this year compared to prior years when we've been impacted by severe flu seasons?
When we've been impacted by severe flu season, we wouldn't have, for example, 2 weeks ago, we had close to 725 people in the hospital that had COVID. On a normal year, we might have 200. So it's 3 times worse than the regular flu season has been. And many of these people are very, very sick. They're on ventilators. They require constant attention. And if you're a really sick COVID patient, you might have 4 people caring for you because of all of the needs around your type of disease that you have and what it takes to turn you to have you on a ventilator to watch you closely. Whereas in the past, we would have 1 nurse for 2 patients. Sometimes now we've had 4, not nurses, but 4 caregivers to one COVID patient.
Got it. Thank you, Linda. Let's bring Mark back in. I have a question here for you. You did touch on this again, but maybe in talking about that pace of returning, which you were alluding to earlier. At this point, what does the recovery shape and trajectory look like for the country? And from watching Chris, he's done great at the U shape, the V shape. Give us your insights at what the recovery and shape really looks like.
Well, from the onset of the pandemic, my view has been that what we would see is a bumpy Nike swoosh. That it was a very elongated recovery, but it wasn't going to be smooth at all, because I knew that we were going to see setbacks, because we constantly are learning new things about the virus. And at its onset, we thought, okay, we're going to have this first wave and then it's going to subside during the summer. But then we had this summer wave of infections, and that cooled economic activity. I think the latest thing that we've learned is that these blanket shutdowns are not the best way to deal with businesses. If you look at states that basically said, listen, all businesses, any business can reopen as long as they can reopen safely, as long as they can put the protocols in. We're not going to say this industry is permitted, this one's not permitted. And Georgia is a good example. They got a lot of criticism because that's what they did at the very onset. And Georgia has replaced 82% of the jobs that were lost during the first 2 months of the pandemic. When the job losses occurred, they've added jobs every single month. And their incidence of COVID and their incidence of COVID deaths are in proportion to their population. So they're the 8th largest state. They've had the 7th largest number of cumulative cases, 10th largest number of cumulative deaths. So there's no doubt that there is this trade-off here, but I think that the blanket shutdowns have done more harm more lasting harm. And just to echo on Chris's comments a little bit, there is a decided move away from markets that are deemed dysfunctional. And that dysfunction is in the way of government, government policy, and you are seeing an outmigration of businesses away from that because they look at how they responded to COVID and they said that's how they're going to respond to crises in the past. I don't want any part of this. I'm headed to someplace that does it right. And so that is something that is going to carry through in a big way. I mean, look at it. A popular TV show is Cobra Kai. It takes place in Los Angeles. It's filmed in Atlanta. I mean, that tells you something about how hard it is to get something done in LA in the midst of the pandemic. So I mean, those are things that I think are going to carry through. Those are lessons that we've learned. But in terms of where we're headed here, we think we're going to have a much stronger second half of the year, but we don't know. We just don't know how the vaccinations are going to play out, how the vaccines are going to play out. We're very hopeful and very encouraged by what we're seeing, but hopefully we don't see a setback and some sort of mutation of the virus, because we learned from COVID at the onset that, oh, it's not just a threat to supply chains. Oh, it's not just a threat to some areas of the country. Once it gets a toehold, it seemed to spread very, very quickly.
Yeah, thanks for that perspective, Mark. And I'm glad we got a Cobra Kai plug in this episode. That's fantastic. Chris, I'll let you weigh in too, because a lot of what was said there, again, it's prioritizing or the healthcare and the economy. I'd love to hear what you have to say after listening to Mark's statements.
Well, I think it reinforced what I said earlier too. I 100% agree with what Mark illuminated, that places like Atlanta and Dallas and Phoenix and others have been held in high regard for not only our response, but also we've been able, and I'd even argue for years, we've been focused on being pro-business, on being problem solving and really pragmatic for how we interface with industry. Whereas some of the other markets, including California, New York, Chicago, some of these others that have responded with just draconian approaches to this COVID era, not only economically are they feeling the challenge, but politically too. And so that'll continue to be a challenge. I know in our state, our kind of key business groups, including Arizona Chamber's taking the lead, but also Greater Phoenix Chamber, GPL, us, and many others are coordinated on ensuring that we have liability protection reform going into place to ensure that small and large business get treated fairly, because there's a lot of concern about what happens when, not only do we go back, but we go back at scale, and how long will kind of the COVID threat persist from a legal implication perspective, when a lot of these business owners, small business particularly, are trying to survive. And the governor and Dr. Christ have been very clear about opening safely and ensuring that even some of the recent CARES Act dollars they've put into significant resources for small restaurants in terms of outdoor furniture for something so simple, but yet those things go a long way for a small business survival. So these COVID liability protections are going to be pivotal, and I know that a lot of our legislature is focused on that this year. And again, I think I don't think I've ever said this before in all my years doing this, but typically companies look at cost, they look at regulatory impacts, they look at talent base, infrastructure, livability, all the core attributes. But one key ingredient that's now woven in, and it's what Mark said, is kind of political liability, the risk that moving into a market could have not only to your brand, but your ability to operate. I mean, those are key factions that companies are considering today. So I appreciate, Mark, you bring that up, because it is a critical issue for companies as they're going through their final site due diligence process.
All right, thanks, Chris. We're going to move on to final remarks now. I'll just go around the panel, and we'll start with Linda. We've heard a lot today, and we've heard a lot from both sides there, the economy and healthcare. So just want your perspective and your final thoughts after a very, very productive discussion here over the last hour.
Well, as I said, I think it's been a very interesting year, and what an anniversary to celebrate. It's been 1 year that we've been at this. Unfortunately, we were one of the first places that saw COVID here in Arizona, because we had a young student who had visited family in Wuhan and went to our emergency room. So it was a aha experience that you think about something happening across the world, that all of a sudden it's arrived at your doorstep. As I've said to you, I think that the vaccines are exciting, but it's not the cure-all yet. We have to have herd immunity. And so we have a long way to go, as Dr. Chris said. So don't stop what you're doing. Wear your mask, wash your hands, keep your circle small. If you're feeling ill, please don't go into work. And if you've ever thought about working in healthcare, we've got a great job for you, guaranteed future. Thank you so much.
That's awesome. Mark, final thoughts?
Yeah, I just want to say that we are encouraged. I mean, I do like to present the risks that are out there, but it is encouraging. When you go through a recession, it tends to accelerate trends that were already in place. And I think a lot of those trends are very favorable to Arizona, not to mention that all the baby boomers are going to be 65 or over by the middle of the decade. So we've got a lot of trends that are going to be very favorable going forward. And I think that once we move past COVID, we're going to have a nice bounce to economic activity that's going to be lasting for some time.
All right, Chris, I'll let you close us out here.
Great, thanks. And thanks to the panelists for joining us today. I know we had a great audience attendance and participation, and I'm just elated that Bethany and Nicole and the team can put these together and have them be such a robust conversation each time, and differing viewpoints and just in-depth knowledge to exchange. So just to close, I do feel much like Mark alluded to, I think 21 for Metro Phoenix is going to be our year of recovery. The bounce or surge that we expect on the economy will happen. But again, I also go back to any type of volunteerism or support we can have for our healthcare community. Let's do that now more than ever before. And then second, the buying local aspect. I think this is a really important part of our recovery, in that corporate America has bounced back and they're looking at cost optimization and consolidation. And I do believe the region's going to be a big winner as you look at financial services, corporate services, advanced manufacturing, all that we're going to be competing for on that top echelon scale. But the lagging part of our economy that's creating the unevenness is really going to be about small business, minority-owned businesses, women-owned businesses. Anything we can do as Valentine's Day is coming up, feel free, buy local, spend local, and support your local neighborhood business, because that's what's really going to give us that balance for 21. So thanks again for joining us. And Eric, I'll kick it back to you.